I'm Kara Hanson. I'm Professor of Health System Economics at the London School of Hygiene and Tropical Medicine. I'm a co-research director of RESIST, which is a DFID-funded research consortium that looks at how to make health systems more responsive and more resilient. Universal health coverage is about making services accessible to everyone in a way that doesn't lead to financial impoverishment, but also allows them access to the services that they need at an acceptable level of quality. So a lot of governments are looking now at how they can make their health systems move in the direction of universal health coverage. And that involves countries at lots of different levels of development. So different countries will take quite different trajectories towards UHC. Universal health coverage is important for low and middle income countries because they're all struggling with how to ensure access to health services for their populations. They generally don't have all the resources required to reach everyone with all those services immediately, and so it's quite important to plot carefully the path towards universal coverage in different settings. So low and middle income countries that are thinking about how to achieve universal health coverage will have to think about the main health financing functions. So they have to think about where they're going to raise more money from, how they're going to pool it in ways that allow people to be protected against the risks of ill health, but also allow cross-subsidies. And that's cross-subsidies between the sick and the healthy, and between the rich and the poor. They're also going to have to think about how they use those pooled resources to purchase health services effectively. And that means thinking about what services they want to make available, about who's going to provide those services and through what means, and how they're going to pay those providers to try to get outcomes that are efficient and equitable and high quality. So imagine you're a mother with a sick child, and you need to get them to a health facility. You might be faced with a long journey, so you might be faced with transport costs. When you get to a health facility, you want to be sure that there's going to be a health worker there who's trained and qualified and ready to help you, to make sure there are drugs in stock, basically to make sure that all of those inputs that are needed to deliver services effectively are in place, and also that you can use those services without having to pay impoverishing amounts for them. So ideally that means having no user fees at all, especially in these poorest countries for these types of maternal and child health services. But if there are user fees, to make sure there are ways of identifying people who shouldn't pay them, people who are exempted from them. RESIST is a DFID-funded research program consortium. It brings together research groups from 7 different low and middle income countries in Africa and Asia, and we aim to generate knowledge that will help to strengthen health systems. We do this by working in 3 main themes. We're doing work on health financing, we're doing work on health workers, and we're doing work on governance and accountability of health systems. We're also trying, where we can, to look across those themes to see where financing and governance interact, or where financing and health workers interact. We've developed a program of research that we'll conduct over a 6-year period that will take place across all of the consortium countries and produce some results that should be helpful for strengthening health systems in those places and beyond. In our health financing theme, we're looking at a couple of issues. One is at fiscal space. So how governments can spend more of their own national resources on health. And this is important because health systems that are predominantly funded by donor funding are really vulnerable to shocks. All you need is a set of donor governments to say, we're not going to fund your health system anymore, or an economic downturn in the OECD countries, or any number of shocks can lead to a real interruption in funding available. So we're interested in thinking through how countries can generate more of their own resources, but to do this through progressive means. So looking at systems that will generate pooled funds. And one study that we're doing is looking at at tax collection and try to understand how governments can increase the effectiveness of their revenue collection services and how the Ministry of Health can get more of that money for the health sector. Another project we're doing is looking at purchasing. We think that purchasing is one of the most neglected health financing functions. So purchasing has to do with the way services are specified, the way they're contracted, and the way they're paid for. And we're going to look across all 7 resist countries at purchasing arrangements, looking at both at public purchasers, thinking about the government as a purchaser of services, and also at private purchasers to understand how bodies can use strategic purchasing more effectively to improve the services that they are making available. And that's, of course, a really important part of universal health coverage. Part of UHC is about health financing and risk protection, and part of it is about making sure that services are available, accessible, and high quality, and purchasing is really central to that.